Hi everyone, welcome to my YouTube channel. It's all about the respiratory therapy, and in today's lecture we're going to learn oxygen therapy. Firstly, don't forget to subscribe my channel and hit the bell icon. You don't have to take screenshots of each slide. Just go to my Instagram from the link in description below and DM me the title of topic you need slides of. Introduction. Oxygen therapy is a critical intervention in respiratory care. It involves delivering supplemental oxygen, O2, to patients with hypoxemia, low blood oxygen levels. Goal: maintain adequate oxygenation while avoiding oxygen toxicity. Indication for oxygen therapy: hypoxemia, low blood oxygen levels, defined as PaO2 less than 60 millimeters of mercury or SpO2 less than 90%. Causes: COPD, pneumonia, ARDS, pulmonary edema, asthma attacks. Acute and chronic respiratory failure. ARDS requires high-flow oxygen or mechanical ventilation. Chronic lung diseases, e.g., COPD, pulmonary fibrosis, may need long-term oxygen therapy. Post-surgical and trauma patients. Patients recovering from anesthesia, chest trauma, or surgery may require oxygen support. Oxygen delivery devices. Low-flow devices provide variable FiO2, fraction of inspired oxygen. A. Nasal cannula, NC. Flow rate, 1 to 6 liters per minute. FiO2, 24 to 44%. Advantages: comfortable, allows talking/eating. Disadvantages: ineffective in severe hypoxemia. B. Simple face mask. Flow rate, 5 to 10 liters per minute. FiO2, 40 to 60%. Advantages: higher FiO2 than nasal cannula. Disadvantages: uncomfortable, must be removed for eating. C. Non-rebreather mask, NRB. Flow rate, 10 to 15 liters per minute. FiO2, 60 to 100%, highest without intubation. Advantages: delivers near 100% oxygen. Disadvantages: not for long-term use, risk of CO2 retention. High-flow devices. A. Venturi mask. Flow rate, 4 to 12 liters per minute. FiO2, 24 to 60%, precisely controlled. Advantages: best for COPD patients who need precise oxygen levels. B. High-flow nasal cannula, HFNC. Flow rate, up to 60 liters per minute. FiO2, 21 to 100%. Advantages: provides humidified, warmed oxygen and reduces the need for mechanical ventilation. Oxygen titration. Oxygen titration guidelines. COPD patients. Target SpO2 88 to 92%. Avoid excessive O2 to prevent CO2 retention. Other patients. Target SpO2 94 to 98%. Critically ill patients may require high-flow oxygen or mechanical ventilation. Oxygen monitoring. Monitoring oxygen therapy. Pulse oximetry, SpO2 quick, non-invasive measurement of oxygen saturation. Arterial blood gas, ABG measures PaO2, PaCO2, and pH for accurate assessment. Capnography, EDCO2 monitors CO2 levels in ventilated patients. Indication for oxygen therapy. Acute conditions: hypoxemia, ARDS, severe pneumonia, pulmonary embolism, sepsis, carbon monoxide poisoning. Chronic respiratory diseases: COPD, pulmonary fibrosis, cystic fibrosis, neuromuscular diseases. Post-surgical and trauma patients, postoperative recovery, chest trauma, rib fractures. Special cases: cluster headaches, neonatal care. Contraindications for oxygen therapy. Absolute contraindications: paraquat poisoning, premature infants, risk of retinopathy of prematurity. Relative contraindications and risks: COPD patients, risk of CO2 retention, fire hazard, oxygen toxicity, long-term high FiO2. Oxygen therapy is crucial for treating hypoxemia, but must be carefully managed. Choosing the right oxygen device depends on patient condition and oxygen needs. Monitoring with pulse oximetry, ABGs, and capnography ensures safe and effective therapy. Thank you. See you in the next lecture. These are the basic lectures of respiratory therapy. We will move towards in-depth of each topic in lectures ahead.